Hello everyone, I am Wahida Kazi. I'm a public health professional. Today I'm going to discuss a topic. It's foodborne illness during pregnancy. It's an important topic. I'll also briefly discuss current role of healthcare providers to enhance food safety knowledge among pregnant women. It was a review article that got published on August 2019. We all know that dietary and food and diet and nutrition related counseling is popular as part of prenatal counseling. When a pregnant woman or a person who is planning for pregnancy visit to healthcare facility, the healthcare provider usually advise them on extra demand of nutritious healthy food during pregnancy that include micronutrients such as iron-rich food as well as vitamin B complex or especially folic acid to prevent any congenital fetal malformation. But unfortunately, the food safety related advice is often ignored. In my review, I noticed there is inconsistencies exist both in developed and underdeveloped countries where healthcare providers do not counsel patient on food safety issues. As a public health professional, we all know we can't overlook the burden of foodborne illness during pregnancy and its detrimental outcome on pregnant women and fetus. In my article, I suggested to include the food safety counseling as part of prenatal counseling, and I also suggested to further research is required to find out more effective way to communicate food safety information to our pregnant patient by the healthcare providers. Because healthcare providers are important the part group, because the pregnant women, they rely on healthcare providers for pregnancy related advice, and they have a trusting relationship with their patient, and these patients from different cultural background, they often rely on advice from their doctors or the nurses or midwife. More seriously, they take those advice than from a neighbor or from a relative. So basically, during my review, the objectives of this article to introduce common foodborne pathogens that can cause detrimental effect on unborn fetus as well as cause illness among mother. There are multiple, couple of 100 to 1,000 pathogens that can cause foodborne illness, especially infectious diseases, but we are not focusing on all of these groups. We are discussing selected pathogen that actually has detrimental effect on unborn fetus. It's important because pregnancy, it's the expectation there will be healthy baby, and so it's important to prevent illness among the baby. In this article, the one part of this article is also to discuss the socioeconomic and cultural factors that can influence food selection and food intake behavior among mother during pregnancy. We suggested a food safety guideline from a reputable source such as Center for Disease Control as food consumption guideline for pregnant women to prevent foodborne illness. These include like what to avoid during pregnancy, and what reason for avoidance of certain food, and what are the alternatives available to replace those food. Finally, we talk about research to find out the ways to communicate with pregnant women about food safety. For that, we suggested that we need the culturally sensitive resource that match with women who are from different background. So the factors that need to be considered is the food selection behavior, the geographical food consumption habit, and also based on the language, religious belief. Those things need to be considered to create effective, culturally sensitive food safety recommendation for pregnant women. So during the review, I found main 5 pathogen. We discussed this list. I would like to discuss briefly, especially focusing on the effect on mother and fetus. Surprisingly, one of the infection, this very common infection, is hepatitis A. Hepatitis A, the incidence and the pregnancy outcome is not very clear based on statistical data. The data are insufficient because this infection is poorly reported, underreported during pregnancy. But when the infection happens in the 2nd and 3rd trimester, mother can suffer from different kind of pregnancy-related complications, such as one of them is premature contraction of uterus. We know what that means threatening the pregnancy. Abruptio placenta, as well as premature rupture of amniotic membrane is common, that can lead to preterm baby. And if there is no medical facility to take care of this premature baby, the baby's life and health can be compromised. Usually the hepatitis A, we know that it comes from the unhygiene or environmental lack of hygiene during food preparation can be one of the cause of hepatitis A. Indirect contact with a person who got recently sick with hepatitis A, and it is a fecal-oral transmission. So food and water can be contaminated in some endemic countries that can lead to hepatitis A. And a person who is unvaccinated for hepatitis A, if they travel to an endemic country, they can get hepatitis A infection. The next pathogen I would like to mention is Listeria monocytogenes. The Listeria has predilection for placental barrier. It can cross the placental barrier and infect the fetus. We know that high-risk foods such as cold-cut meat and the dairy that made out of unpasteurized milk are a main source of Listeria. And Listeriosis among pregnant women, the incidence is somehow 10 to 15 times higher among pregnant women than the general population. And the listeriosis among pregnancy actually constitute almost 21% of total listeriosis worldwide. And mortality, including neonatal mortality from listeriosis, is also very high. It's almost 15%. So the mother can suffer wide range of symptoms, from asymptomatic mild influenza-like illness to severe acute illness such as meningitis that can lead to headache, photophobia, neck stiffness, and high fever. Gastrointestinal illness are common, but listeriosis, as it crosses the placenta and infect the placenta, the fetus fetal consequences will be the stillbirth, the premature birth due to abruptio placenta, and also if the fetus is born life and term, that fetus can infected with listeriosis, born with severe infection. The next pathogen that I'm going to talk about is Toxoplasma gondii. Toxoplasma gondii, it's a parasite, we know, and it is very common infection, often in general public who are immunocompetent, the symptoms may not be very, specific. It can be very asymptomatic or non-specific symptoms, but people who are immunocompromised and it can cause blindness. That's one of the complications. And it is one of the infection that is actually part of the prenatal screening. You heard about or are having this infection. And pregnant women should be concerned because the cat is the definitive host, and the cat feces excrete the oocyte. People can be inadvertently exposed to this oocyte, or people can eat meat that is infected, and the meat, if not properly cooked, the cyst can survive in the meat and infect human. So cat is the definitive host, and human, other cattle, those are the intermediate host. Livestock, once infected, they can be carry this parasite for life and pass it to human who eat meat that is not properly cooked. The fetus born with a mother who got ill with toxoplasmosis, as a result of vertical transmission, the baby can born with mental retardation and also blindness. This one is botulinum, Clostridium botulinum. Clostridium botulinum can be passed from food, especially food that are canned food or home canned food or jarred food. When the pH balance and the temperature abuse or anaerobic condition, those are the favorable condition for Clostridium botulinum to germinate. When the pH is the higher than 4.3, less acidic, and lack of oxygen, that can help this organism to grow, and so the cyst can germinate and produce the toxin. It is difficult to kill. Sometimes the spore can be very heat stable, though Clostridium botulinum, the toxin is interesting one. It's a neurotoxin, and it causes flaccid type of like paralysis. And how it works. The botulinum toxin actually go to the neuromuscular junction, where it prevents release of acetylcholine, one of the important neurotransmitter that actually bind with receptor on the muscle to cause muscular contraction. So when the toxin actually affect the neuromuscular junction, it destroys some of the protein that are required to release of this acetylcholine from synaptic vesicle to the synaptic cleft. And because of this toxin, the acetylcholine does not release at the synaptic cleft, and the muscle cannot contract when it required. Rather, muscle become paralyzed. So this is the main principle how these toxins work. And based on this muscle paralysis, we can see the symptom can progress over time if there is no urgent treatment. Usually treat within 72 hours in some toxin can recover the patient. But if no proper treatment, the symptom can progress, and the symptoms may start with gastroenteritis, then the progressive paralysis, muscle paralysis that can lead to difficulty swallowing, respiratory failure, and the patient may need to go to the ICU because of respiratory failure, and sometimes some patient may die and remain persistent vegetative state. And the other symptoms are related to the eye symptoms, like blurring of the vision, and diplopia is common. So if somebody is suffering this infection and there is a association with eating canned food, we need to think about Clostridium botulinum. So what effect the fetus suffer? One of the article actually that was that discussed a study that done among pregnant women who got botulinum, Clostridium botulinum infection during pregnancy. 16 mothers case study was done, and it was noticed that the fetus doesn't usually get vertical transmission from mother to have congenital botulism. But what happened, most of the fetus die or born premature or the preterm, and one of the reasons for preterm delivery is the iatrogenic or the induced the delivery, where doctor need to do the immediate cesarean section or delivery to save the life of the mother, to decompensate their symptoms. So that's one of the reasons the fetus will suffer from illness that is related to preterm liver. Finally, I'm going to talk about hepatitis E. Hepatitis E has 4 genotype hepatitis E, type 1, 2, 3 and 4. 1 and 2 is predominant in Southern Asia, in the flat plain land. I would say it is due to the natural water often get contaminated with human sewage, and this hepatitis E infection during pregnancy cause it has higher mortality and morbidity, and almost 2,000 to 3,000 stillbirth of baby per year due to hepatitis E infection among pregnant women. So it has detrimental effect on fetus, and neonatal death, infant death related to hepatitis E is common in Asian countries, and especially in poor underdeveloped countries. Type 2 and 3 is more seen to infect both animal and human disease, and these are predominant in the developed world. That's all about hepatitis E. And one important thing to mention, unlike hepatitis A, hepatitis E can pass vertically, and it can also pass through breast milk when the mother is acutely ill and suffering the increased viral load. So what is our expectation from healthcare workers? In my article, I suggested that healthcare workers, as they counsel their patient during prenatal visit on a diet and nutrition related counseling, it is also important to include the food safety related counseling during pregnancy. Mainly they have to discuss with their patient why certain food such as cold cut food, dairy product from unpasteurized milk, even the soft cheese and other kind of food, why some food is high risk for foodborne pathogen, and the reason for it is important to avoid this food during pregnancy, and what is the alternative, because some of the food that are high risk category can be cooked properly or reheat to kill some bacteria and reduce the risks. For example, steaming of the cold cut meat or reheating of the cold cut meat can reduce the number of bacteria in it. And also the mother should understand the basic food safety measures that they can implement at home to prevent foodborne illness. The doctors can provide them with the required resource, and finally they need to talk to them about the hygiene, environmental hygiene, cleanliness and hand hygiene especially. Yeah, that those are not this is one of the the important work or the action doctor can take because they can advocate for food safety among pregnant women. In this review, I also found several global socioeconomic and cultural factors that influence maternal food intake and food selection behavior. I will briefly discuss that. The findings that poverty, food insecurity were common factors, and inaccessibility of the food. It's not only due to the economy but also due to the geographical factor and climate. In certain geography, some crops may not produce. It is difficult to find certain food that are important for pregnant women. So there are lots of cultural belief and cultural influence. Culture and tradition related concept of healthy food and unhealthy food. For example, in some community, the healthy food means protein dense food, the fish, and also vegetables. And unhealthy food means the high sugar dense food and deep fried food, for example, commercial products. And it is good that they know this concept, but the problem is due to lack of food safety knowledge. Sometimes they consider the healthy food always healthy without further consideration of what is the source of this food, how the food was stored in the whether it underwent some sort of temperature abuse or not, and when the food was prepared. So they need to learn this kind of food safety knowledge to ensure the healthy food is actually safe to eat. Another kind of cultural, there are multiple cultural taboos in address or described in many articles. Some of them I just briefly want to discuss. One of them is in some underdeveloped countries where due to geographical the factor, certain crops cannot be produced. Those have extra value to them, so they preserve those food or store this food only for selected group of people in their community. For example, maybe the rich and also the male dominant society, the male who work hard to earn money, they will have this food, but the women and children often neglected. So the pregnant woman can also have have to avoid certain food or has restriction on the food that they can that can be available to them. So those are important factor. Another food taboos were in some community the women eat less at the end of the pregnancy, hoping that the child will be the small or not oversized. That will age the process of delivery. Interesting. And some culture of the food taboos even exist in developed world. For example, United States, in some state, it is still allowed to sell unpasteurized milk, although there are from the past history it shows unpasteurized milk is often associated with many multiple food pathogens. But still it is allowed, and some group actually support because they believe pasteurization will kill bacteria as well as it will kill many important essential nutrients in the milk. Some of them could be enzyme and the milk nutrients that are important can be killed by pasteurization. Although the scientific evidence to support those claims is not available. Anyway, so food taboos are important piece to consider. And again, some women cannot visit prenatal screening, for example, due to the lack of social support, the distance between where they live and the healthcare facilities, and some women can be under influence of alcohol, drug. That might be one of the cause of not seeking medical advice during pregnancy. These are the important socioeconomic and cultural aspect need to be considered when we think about food safety knowledge and disseminate food safety information to our pregnant women. That's all in this article. So we suggested culturally sensitive educational resource that consider this socioeconomic and cultural factor as well as the language, for example, local language and local food eating behavior or food availability. So the one size fit all doesn't work in public health. we have to look through the equity lens to ensure the people in every corner and in every geographical area have their own norms. So the health resource should be adapted based on the cultural sensitivity. So what we learned from this article, just recapping some of the important piece here. The pregnancy is often vulnerable, so foodborne illness can make this woman more vulnerable, and it often causes vicious cycle of malnourishment and poor health among pregnant women, even women at the reproductive age and their fetus. The food poisoning, it's not only a local problem, it is a global the public health concern. Every year 600 million people get food poisoning, that is 1 out of 10 people. So it's a huge number, and it is important to take all kind of measures to prevent foodborne illness among vulnerable groups, especially the pregnant women. And so prenatal counseling should consider food safety counseling as one of the essential component, along with dietary and nutritious counseling. It is important to ensure both components are covered equally. And also finally, I would like to say, as the public health professionals or the healthcare professionals, we have to advocate for this issue, and we need to encourage government to provide us more resources to research on this issue. It is still more work to do, how to communicate a culturally sensitive way the food safety recommendation to our pregnant women, and to prevent foodborne illness among our target population. Thank you for watching. Thanks.